So I know whenever you first reached out to us, your chief complaint was your teeth were in bad shape, had broken teeth, the gum line. Tell me a little more about that. What brought you here, and how was your situation prior to getting the full mouth restoration?
Yeah. I got to a point in my life where I was literally taking antibiotics constantly for abscess and having a hard time eating because I had so many broke teeth. I was missing only one tooth, actually, that was pulled, but I had 4 or 5 that were broke off at the gums of my chew teeth. It was really hard eating. I had a lot of infection, constantly had infection in my mouth, and of course will cause bad breath and a lot of sleepless nights from toothaches.
And how long did you experience that?
It was years of going like that. I just got to a point, at one point I'm like, I'm too old to get new teeth, I'm just gonna have to deal with it. A lot of it's hereditary. My mom had false teeth in her 40s. My dad, when he passed away, he was 80. I think he had 1 tooth. My brothers had a lot of trouble with their jaw teeth, doing the same thing. So I think a lot of it was hereditary as far as the way our teeth were.
That's one thing we do tell our patients: you're never too old to get new teeth. You don't have to live like that.
It was pretty miserable. I lived on antibiotics. I'd get an abscess and it started hurting. I'd pop antibiotics until the abscess. I don't know if it ever went away, but it'd go away enough it'd stop hurting.
Yeah,
until
it just repeat itself.
Constantly repeating. So.
Yeah. And so you decided to do something about it. You reached out to us and said you didn't want to look at removable options.
Right.
You wanted to look at fixed options.
Right.
So you did the zirconia teeth.
Yes.
And you've had this for about 2 weeks now. How has that been?
Oh, I love it. Prettiest smile I ever seen. So I like my smile. People really like the way it looks on me. I'm still getting used to them because it's only been a couple weeks, but just getting used to them. I still bite my tongue. If I forget to put my mouthpiece in and I fall asleep, I'll bite my sides of my tongue because I don't have my mouthpiece in. But
that's an adjustment period.
Just getting adjusted to it. Being able to eat after almost 6 months of not getting to eat very much, that's nice. But being able to chew and actually eat more solid foods. When I first came here, I was 192 pounds. I'm 159 right now. So that's 4 or 5 months eating. You start off eating, you're on a liquid diet, and then you're on soft diet for several months. And
how was your experience with that after the procedure?
Well, I'll tell you the truth. The temporaries look good, but they were uncomfortable. They just were, because they were thicker. It took up a lot of room where my tongue sits. So it was sore because the temporaries wasn't very comfortable. I constantly was rubbing because it was just uncomfortable. But I tell you, when I got a couple of weeks ago, when I got my permanents, I was like, oh yeah, this is so much better. So much better, so much more comfortable. They actually fit where my gums are. And so now I'm happy. I'm real happy.
And we love to hear that. Whenever you talk about the bulkiness of the temps, people with dentures, that's right. What it's like, but worse, because right. It's sitting on the tissue and they're even a little bit thicker than that.
I knew from my mom's experience, I didn't want to have to take teeth out and put them in at night and stuff. If I'm going to get new teeth, I don't want them to come back out of my mouth. I want them to stay in there. I want them like real teeth. Yeah, it'd been a lot cheaper to do dentures, but the thing I always noticed about my mom is when she lost weight, they didn't fit. They were loose. And she was always having to get them adjusted or fixed. I don't want to do that. I want permanent. It was the only way I'd do it. I told my wife, I'm going to get these yanked out of my mouth, all my teeth pulled out, and the one that's going back in is going to be permanent, or I'm not doing it.
And that's what you got.
Yeah.
Speaking of your wife, Monica, what was her reaction the day you got your final teeth in?
She couldn't stop smiling. She thought those were beautiful. I remember at first I wasn't going to get them as white, and I thought, you know what, I'm spending the money. I want a white smile. It's funny because the first time I ever took a picture and smiled, and I'm thinking, my God, them things are white. It has changed my features a little bit. Of course, it's going to, because they're not the teeth I used to have. And I didn't smile before because of my teeth. So being able to smile and actually show teeth is different for me.
Is that one of the biggest things you've noticed in your day-to-day life since getting your teeth? Is your ability to smile? And
Oh, yeah, yeah. Because for years, I would smile, but it'd be a closed mouth smile. Never showed my teeth. So to be able to do that, it's kind of shocking when I first see pictures of me and you can actually see my teeth.
That's awesome. But beyond just the looks of it, the smile, what does it mean to you to have your teeth back?
It means the world, because I'm not living with infection and pain anymore. For years, I was living with that, and it was miserable. It changed my whole demeanor, because now I'm happier. I'm not hurting all the time. That's the main thing. I constantly was hurting all the time from those infections. When you're hurting all the time, you're going to be in a worse mood. And so my mood's improved so much more. It's just a million times better all the way around.
That's awesome. We'd love to see that improvement in your day-to-day life.
Oh, yeah.
And there's so many people that come in here from the first time to get a medical consultation, you can just immediately tell that they're sick of living the way they've been living.
Oh, yeah.
It's constant pain.
It's miserable. And that's the reason I was such a stickler with all my kids growing up about their dental. And I spent $10,000. My daughter has one of the prettiest smiles you ever see in your life, but it didn't start out that way. When she was a sophomore, we had braces put on her. She got perfect teeth. And she's 37 now. She still, when she goes to bed, puts that retainer in her mouth. And that was from 10th grade, and she's 37. She is like, I'll never go back to where my teeth will be like that again. I was very stickler about you brush your teeth, you floss, because I knew what I grew up with and the way my teeth were, and I didn't want my kids to be that way. My daughter was pretty excited the first time I smiled at her, too, seeing her daddy with big old white teeth, because I just didn't smile that way. So it's been a complete life change as far as me and my interactions with my family and friends. So I love them.
That's awesome, William. We appreciate your time taking all this and kind of opening up a load, teaching that with your daughter and ingraining that.
Yes.
That's how my parents were in a similar way. They had some dental issues, and that's where I got my habits from. Mm-hmm. I'm like, oh wow, I see the importance in that.
You wouldn't think, because you smile and you eat and you talk, but people don't realize how important your teeth actually are, and how much misery and pain when they're not right it causes you, and it changes the whole outcome of your demeanor and the way you interact with people and your own family. I don't have the pain no more. That's the A+ right there. I'm not living with pain. I have to get used to these, which compared to 2 weeks ago, I've already gotten a lot more used to them. But learning to talk with them is a bit of a challenge.
But over the next month or so, it's kind of like your tongue gets trained to where
Right.
it's going to hit
Right.
on the teeth.
Yeah. Them temporary, you could really hear it in every time I talk, I'm like, man, am I going to lisp like this all the time? These, I can hear it a little bit, but not even close to what I was. And that's what even my son downstairs, he's like, you're talking better with these. I'm like, yeah. Because the thing is, I'm also a minister, so I preach. So I talk a lot. I don't want to get up there and people are hearing that more than they are the message. So.
And how's that been? Like ministry, being able to preach?
It's getting better. I'm getting more comfortable with these.
Has anybody at your church noticed anything or said anything to you?
Oh yeah, they know about my teeth. Yeah, because for 5 months going to church and explaining these are my temporaries. Yeah.
Well, I'm glad it's been able to improve those aspects of your life.
Oh yeah, the quality's a lot better.
Yeah.
A lot better.
Awesome.
So.
Well, I appreciate you taking the time.
Oh yeah, you bet. Thank you.